as you come in. You're well practiced at this now, but please mute your microphones so we don't hear your conversations. You can have your cameras on or off as you choose. We find that the signal is better if they're off, though. So we're just going to let a few more people in, and then we'll be able to start.
Okay, that's interesting. For some reason, the chat column won't let me attach my picture today.
Oh, well, you carry on, Jane, and I will waffle about the weather. And everybody can give me a wave and turn their cameras on. So this afternoon, we're joined by Jane. I can see that Fidelia is on the call as well. I'm here, and then Jessica from our business support team. Any questions you've got, put them in the chat, and we'll monitor that. And then there'll be time for any urgent verbal questions that you've got as well. Okay, fabulous. Jane, is it doing what you want it to do?
No. So hello, everybody. I hope you're all okay. Normally, I would put in the chat column a couple of graphs that explain the numbers in the county. Jessica's managed to get them through. Thank you, Jessica. That's really helpful, because my system is currently saying, my computer says no, but Jessica's put them there, so that's really brilliant. Thanks so much. Good afternoon, everyone, and thanks very much for joining us once again. I can only begin to imagine how busy things are for you just now, so we do really appreciate you taking the time out to come and check in with us. I'm Jane Coates, and I'm the COVID testing lead for Warwickshire, and I'm based in the public health team. My colleague Fidelia Richardson, also from Public Health, is joining me today, and of course we would not be here without Amanda, Sonia and Jessica from the Early Years Advisors team, who provide you, I know, with all of your regular information updates as well as support. As Amanda said, please put your questions in the chat column and we'll do our best to answer them here and now, or come back to you later as we need to. I do wonder how you're all doing health-wise at the moment. I'm just, it doesn't feel like I'm in recovery, but I think I'm probably just recovering from my second cold in 2 weeks. No doubt courtesy of my 14-year-old daughter, who's doing a lot more mixing than I am just now. It's really brought home to me how layered the health challenges are coming into the colder months. Lockdowns have spared us, I think, to some degree from seasonal colds and flu, but it certainly feels like they're making a sharp comeback at the minute. I've started to get flu jab notifications from the 2 local pharmacies that I'm signed up to, and it's definitely on my radar to book one when one of the slots opens up. It'll be my 3rd flu jab, and my experience of them to date has been really positive, I have to say. I can honestly say, although I recognise ironically at the moment, that I've had fewer colds and no full-on flu since I've been having the flu jabs, and I'm really grateful for that. I guess this is just a reminder to you all to look out for invitations for flu jabs, and please do help us by promoting the take-up amongst your staff wherever you can. Flu vaccine eligibility has widened this year on a temporary basis. So in addition, this time around, invitations will also go out to all children aged 2 to 15, but not 16 years or older on the 31st of August 2021, and also those aged 6 months to under 50 who are in clinical risk groups. So that does feel like quite a large expansion of the programme, and it'll be interesting to see how that's reviewed next year. All of the other standard invitee groups will also receive their invitation, but I hope it's just useful for you to know at this point about these additional groups. So I'll move on to my usual fortnightly data roundup of case rates. So do please take a look at the graphs in the chat column, courtesy of Jessica, and do remember, if you double click on them, they'll enlarge so that you can actually read the numbers. I expect you'll already know that Warwickshire case rates as a whole are high, and at the moment we're topping the West Midlands local authorities graphs at just over 498 cases per 100k of population over the rolling 7-day period. Interestingly, Herefordshire is a close second at 491 cases, with some of the more densely populated urban areas a little way behind. When you move down to the district and borough level, however, as we always do, we see a different picture. So Nuneaton and Bedworth for us at the moment is top of the chart with around 580.5 cases per 100k, and Rugby not awfully far behind at about 549. Stratford then, quite unusually, is 497 cases, Warwick with 442, and North Warwickshire quite some way back with around 377 cases per 100k of population. As always, there is constant movement in these numbers. Recent patterns for us in Warwickshire do, however, show persistently elevated case numbers in the Nuneaton and Bedworth and Rugby boroughs. I'm sure you'll be aware that there are a lot more outbreaks in schools, and indeed case rates in our 10 to 19 population is where most of our cases are just now. It's obvious, but worth the reminder that this age group is largely unvaccinated and has only had the most recent access to the COVID jab. Our colleagues at Coventry and Warwickshire Partnership Trust have stood up the school's vaccination programme at quite some pace, and in their first full week of operation last week, they went out to 29 schools across both patches. There's some early indication of variance in vaccine take-up rates that CWPT want to explore a bit more to help them plan comms and messaging to promote take-up in and around those areas. What they've told us to date is that in some schools, take-up of the vaccine has exceeded 75% of the eligible population, while in others it's as low as 35%. So obviously you can imagine we're interested to understand if there's a geographical element to this difference, and we'll do whatever we can to work with our health colleagues to dispel some of the myths that are out there, as we know, circulating really quite widely and quite loudly on some social media platforms. It's good to see that overall cases in early years tend to be here and there rather than in groupings, although I do recognise that even an odd case can disrupt business continuity in small operations like yours. I'm not aware of any specific challenges across early years just now, but did want to flag something that we're seeing in schools at the moment, which is a rise in staff positives. Of course, we can never be entirely sure how COVID moves from person to person, but where there are some obvious overlaps in terms of where people have been, it seems reasonable to try and scale up precautions in those areas. So on that basis, if you have positive cases in your settings, particularly within staff, you might want to think about limiting staff contact in shared spaces such as staff rooms, and to structure team meetings slightly differently to limit how much staff come into contact with each other. We do have an example at the moment of a school in which all of the office staff and the caretaker are all testing positive or having to isolate. And while the school as a whole has actually very small numbers of cases, the ones they have are disproportionately disruptive of their day-to-day business. So there is some thinking that it would probably be beneficial for everyone to do, to think about how you can avoid that coming to pass in your own setting. I think we're all feeling tired of COVID, and there does seem to be a sense that now deaths and serious illnesses have declined, people in general are less worried about catching it. I see a marked decline in mask wearing in my local supermarket, which is at the Rico Arena. I'm definitely now in the minority in wearing a face covering, and it's hard to socially distance in public spaces now when there's not a general observance in giving others a wider berth as we used to. So I guess we really can't be surprised if the virus does now jump from person to person more freely. I still see people using hand sanitizer, but I imagine that is probably starting to wane overall too. The government rules that we now have in place have very few legal requirements on all of us in terms of isolating and health protection behaviours, but there's nothing stopping any of us from choosing to continue those measures that have worked for us to date. So my message today, not for the first time or for the last time, is that hands, face, space, fresh air are still really relevant every day if we want to share the load and reduce transmission of COVID. Ventilation, we recognise, will become a bigger challenge as the cold weather approaches, and particularly with fuel bills now rising. but we can mitigate this to some degree by stepping up our other positive behaviours where we can. Twice weekly lateral flow testing is still absolutely advised, so please continue to promote this as well wherever you can. Of course, there will continue to be instances where we take care, follow advice and still catch COVID, and this continues to be true even for people who are double jabbed. It's always been the case that having the COVID vaccines doesn't give 100% protection, and small numbers of people who are double jabbed will go on to catch COVID, in likelihood much less seriously than they might otherwise have experienced previously. So please do continue to remind your double jabbed staff that they are not immune from infection, and that if we want to bring down infection rates, the effort needs to be made to do the hand space, fresh air on behalf of all of us, whether or not we've had the jab. Before I close, I wanted to bring you up to date on some changes that are happening nationally in the public health arena. On the 1st of October, a new body called the UK Health Security Agency replaced what you would know as Public Health England, NHS Test and Trace and the Joint Biosecurity Council. So those three organisations have all been merged into a single new agency. For the general public, this has very few day-to-day implications, but for public health teams like ours, there is a small ripple effect for us. Things like the changing of staff email addresses, changes to roles and the restructuring of what teams do takes a little while to settle down, and we're beginning to understand what this feels like for us at the local level. So please do bear with us while our national and regional colleagues restructure and get to grips with their new functions. We are here as always to provide the same advice as we have done in the past, but the ways in which we might get that advice are likely to change a little bit. I expect there'll be some blips, as there always are with change, but I hope you'll not experience them directly. But thanks anyway in advance for your understanding if we're not quite as quick with advice as we might otherwise be. Lastly, from me is a reminder from your early years team about the importance of following the three-step process for responding to cases in your settings. It would appear that on occasion, Department for Education contacts have given advice out that no further action is required, but this doesn't overrule the need to complete the three-step process. This is a really important checklist for your individual setting that provides a record of evidence of what you've done in each scenario, so do please continue to apply this as a matter of course. And that, to be honest, is everything that I've got for you today. So we'll pop across to the chat column now and see if anything is going to come in that we can help you with today.
We don't have anything there, Jane, at the moment, so I'll give it a little while to see if anybody wants to add things. Thank you ever so much to you, Jane, because we know that you're feeling really poorly today, and yet you've still come to this meeting with tissue in hand. So big clap from all of us here in early years, because I know you don't feel well.
We really recognise how important the lines of communication are to you all, so there'll always be someone here in every possible instance. So I'm really pleased to be here, and I do want you to feel that you know, we're available to answer your questions as suits you.
Yeah, we couldn't do without any of you. I think certainly internally we appreciate having all of you, and I know that our colleagues out there in the early years sector do as well. So you know, and they're really good messages. Even without COVID, these are the messages that are about good infection control, something which is really, really important when we're working with little children anyway. So we'll keep on with all of those. And I think, you know, you're right, we need to remember that COVID hasn't anywhere near left us yet. And okay, now it might give you a really, really horrible cold rather than hospitalise you, but we don't actually want that either. So I'm still in a minority who is wearing their mask in the supermarket. Okay. Are there any questions for Jane today? Because if there aren't, we'll close this meeting because we're doing the head teacher one, which means we've got to hop over to that. So no questions today. Nobody needs to know anything. Okay, thank you very much for your time. Anything that happens or changes, we'll communicate to you directly, and if not, we'll see you next time. Thank you.
Take care, everyone. Bye.